Hi, my name is Dr. Steve Auerbach. I'm a pediatrician here in New York City. I have great professional experience in healthcare systems, and the problems that St. Vincent's are having are really part of a citywide, statewide, and nationwide problem we're having. Hospitals should be located on the basis of human need and not on the basis of corporate and real estate greed.
Yes.
Woo! The problem that we are having is St. Vincent's has closed, and we need a new hospital on the west side of Manhattan below 57th Street. As you can see from this map, there is no hospital on the west side of Manhattan below 57th Street all the way down the tip of Manhattan. Whether you're in Chelsea, Clinton, West Village, whether you're in Tribeca, any of these neighborhoods, your real estate value, they want to make this a real estate story where the value of your real estate is less because there is no emergency room, no trauma center, no hospital that's nearby. You've already heard stories about folks who've died or could have died because St. Vincent's was no longer there and the emergency travel time was too long. If this is your sick child, if this is your elderly grandmother, grandfather with a heart attack, if God forbid this is a cop who's shot or somebody else who suffers trauma, having to travel through New York City traffic all the way to the east side, the far east side, what is the nearest hospital with a real emergency room? Downtown Beekman. Beth Israel's not a level 1 up to St. Luke's or Roosevelt. That's just wrong. But you know, it's a systematic problem. We're having the same problem with hospitals being threatened to be closed in Brooklyn and community hospitals all over the country. And the problem is they want to tell you these are little one-off events because of a bankruptcy here or a little fraud problem there. They're not one-off events. There's a systematic problem in how we finance our healthcare system and how we reimburse the hospitals and doctors. It's a systematic problem that needs to be fixed. And it's, frankly, the same problem that we're having in a lot of other areas. The same stories you're hearing here is the microcosm of corrupt, rich people who have increased access to our politicians. It's the same problem that we have nationwide across a whole spectrum of issues. It's what's gotten the Occupy movement activated, and it's why even well-to-do doctors like myself and middle-class and working-class people are banded together because we are all in this together. There are attempts to divide and conquer around what people who want construction jobs, people who want good schools, and people who want hospitals, and people who want emergency rooms, and people who want good education for their children, and jobs that pay a living wage. It's all the same issue. We are all in this together, and it is the corrupted political process that remains the broadest underlying problem that will bring us together. So we need to fight for a hospital here on the west side, lower west side of Manhattan, for everybody. We need to fight for health care for everybody, education for everybody, jobs at a living wage for everybody, and we need to remember we're all in this together, and frankly, it's the same fight. Thank you.
Thank you. Yay!